whatever it takes, we will do it to do the right thing. But you both have added an amazing contextual concept about all this. Vicki, anything else?
Yeah, no, I'm not going to belabor the point, but I agree.
No,
PPE is a huge PPE is a huge issue. It's something that NAC and HCAOA and our advocacy efforts right now. That's part of it, making sure that we receive that we are a priority, just like Ida said. Bill mentioned the per visit. Well, you know, our agencies are there for a very long time, and then they might go to another client for another long time. So we not only had to think about PPE, but remember this, our sector that we represent, as I mentioned right from the get-go, we were pretty much personal care. And then this hit. So not only were we introducing PPE to our caregivers, we also had to talk about how to use it, which was a really, really all-out educational effort, because that's also just as important about having the appropriate PPE. Yeah. How do you use it effectively and correctly?
We got a question and a comment. Comment that we had privately and a question on here. You see the question, what's the best way to continue working with state, local, and federal officials on PPE? We've been doing this with the stockpile. My staff continues to work both with South Carolina DHEC and emergency management in South Carolina and the North Carolina people. But any tips of the trade to continue this aspect, both locally, locally, state, as well as federally, and with the nationals?
I think the advocacy has got to be at the local level. And Bill's story, his anecdote about the 6 million, that's what gets people's attention. So in your advocacy, tell the story about you as a provider, what you are facing when it comes to PPE. Bring it down to a story. It is so effective. You know, Bill, I think, mentioned at the beginning of this call about our lobbyists, and, you know, states have lobbyists. You know who's the best lobbyist we've got? It's you as a provider, talking about what you're experiencing during this pandemic. And PPE is a great story to tell.
You know, Tim, with respect to, you know, the state, federal, and local, you know, we would recommend going in all three directions, because all three of them are pointing the finger at somebody else, you know, saying it's their fault that you're not getting the stuff, that you're to blame. But we found a good partner with the media as well, and using stories like Vicki was relaying, you know, really of those individuals receiving care and of those frontline workers. It takes that kind of pressure. The reality, though, we have to recognize, this goes back to what Ido said, you know, we're looking for an allocation of an inadequate number of PPE supplies. And so, you know, we're trying to find bigger solutions, I think, ultimately. And I think that's why you need to continue on the federal level to try to influence the creation of greater supplies, because if you have less than you need for the hospitals, the nursing homes, the physicians' offices, the tattoo parlors, and the nail salons too, you know, the home care is going to always be struggling on this. So supply really becomes the big issue, even more so than lobbying to be a priority.
And now it's the time to do it, right? 5 weeks, we've got some downtime, and now is the time to talk about the need for PPE. I'm sorry, Ido, if I interrupted.
No, not at all. I mean, you know, the fact is the first wave continues, and, you know, we sometimes feel, oh, this is behind. It's not behind us. There are still massive needs for PPE. The biggest wake-up call I had was early on. I spoke to the official who was responsible for the strategic stockpile, and basically realized there was no strategic stockpile, right? It didn't exist. There wasn't a big pile of N95 masks somewhere. So it is the case that in our advocacy, first of all, at the federal level, we have to create more supply. Second of all, at the state level, we have to work with the emergency management folks to make sure that the supply that does exist makes its way to the areas of greatest need. And that's what I would say.
Well, I got a comment that I got through a text, not on the public chat, and it's an anecdote that started early